The coronavirus pandemic has turned our world upside down, and many experts say it may still be a while until things return back to normal. One thing often discussed is herd immunity. Team 12 investigative reporter Hannah Klieger spoke with doctors about what it is, if it's possible, and why it's more complicated than we think.
You may have heard of herd immunity. It happens when a large portion of a community gets sick, recovers, and develops antibodies that prevent reinfection.
If I have the disease and I interact with you and you've already been immune, it's going to stop right there.
Dr. Lamar Hasbrook is a public health professional, a former senior medical epidemiologist at the Center for Disease Control and health director for the state of Illinois. He says there are two ways we can achieve herd immunity. One is through a vaccine. The other option is if a large mass of people becomes infected and develops antibodies.
If you've actually been infected with COVID, you will 100% get some amount of protection from reinfection with COVID, at least again, that strain and that season.
Dr. Torian Easterling is a newly appointed senior officer at the city's health department. He says at least more than half a population would have to have antibodies for this conversation to even happen. And even then, it's complicated.
Because we do not know the ability of these antibodies to really prevent a reinfection, there's no way for us to really match this conversation in a way to talk about herd immunity.
And experts warn allowing the disease to spread unchecked can lead to disastrous consequences. Thousands or millions dead. But despite the dangerous warning, doctors at Park Care Community Health Network in Williamsburg think immunity may be possible. The medical group is part of a chain of 5 medical centers in Brooklyn, Manhattan, and Orange County. Experts here tell us they're seeing a hyper-local incident of herd immunity right here in Brooklyn. They say, just look at their statistics.
This facility, we're getting more than 76% actually, positive antibodies, which means that a huge segment of the community has already been exposed and can't infect others.
CEO Gary Schlesinger says they've been conducting up to 600 antibody tests a day.
We've done tens of thousands of tests.
And he's seeing a correlation across his 5 centers. The more Orthodox Jewish patients a location sees, the more positive antibody tests.
Because we have, the different centers, we have seen that trend. We now realize that herd immunity, that phenomena is out there and it means something.
In April, we saw spikes in cases in areas with large populations of Orthodox Jews. For example, on April 21st, testing sites in Williamsburg and Borough Park reporting between 58 and 74% of people coming in to get tested were sick with the virus. Those numbers dropped by the beginning of May, even though testing continued to increase. Schlesinger says it's all about the nature of this community. Before the pandemic, members prayed together several times a day. Big gatherings were a norm, and families are typically large.
Within the communities that have similar social makeups, there must have been over 1,000 deaths. This will be a case study.
Medical director Dr. Paul Rosenstock says because of this, the virus spread quickly in its early days, and its effect on this community has been especially devastating.
There's a price to pay for herd immunity. And I don't think it was by design. They didn't do this intentionally, but that's the way it happened.
Dr. Rosenstock says they saw a large peak in patients in March and early April, around the Jewish holidays of Purim and Passover.
We've gotten better at treating this. We have resources now we didn't have before. For instance, the Orthodox community has been very, very active for the general population in giving plasma.
If you look at the term herd immunity, you would definitely look at the Orthodox Jewish community as a case study.
Dr. Easterling disagrees.
There is no herd immunity. We cannot have this conversation.
Saying most recent data on the city's infection rates contradicts the message that any community is at or near herd immunity.
Based on the information that we have, we're not seeing that. When we see the positivity rate specifically for neighborhoods as high as they are, then that is meaning that individuals are infectious and that they are transmitting the virus.
Herd immunity, you need about a 50 to 60% infection rate. A lot of people have to die to get to that percentage.
Remember earlier this month, the governor announced a new plan to tackle these new clusters? He pointed to mass gatherings in Orthodox communities, calling them super spreader events.
You've all seen pictures like this for weeks. What did you think was going to happen?
Anger erupted from protesters in Borough Park over his plan to impose stronger restrictions in these clusters and their surroundings. Protesters said community leaders were not consulted. They say many yeshivas and synagogues in Brooklyn closed voluntarily even before the city shut down. And after being at the forefront of plasma donations, this community was now being blamed.
I already had my COVID 6 months ago, and I was home for 2 weeks when I wasn't feeling well, and when I felt well, I came out and I was trying to be as responsible as possible.
But most medical professionals agree that the best way to get through the pandemic is to develop an effective vaccine.
Achieving herd immunity by vaccination would be revolutionary. Achieving herd immunity by intentionally having the population infect itself, I think, is ethically questionable, to say the least.
And as for New Yorkers who were already sick or tested positive for antibodies, medical professionals say the most responsible thing you can do is act like you can still get it. Hannah Klieger, News 12.